Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. An 84-year-old woman with a history of ischemic heart disease is reviewed in their dermatology clinic. Her current medication includes aspirin, simvastatin, bisoprolol, ramipril, and isosorbate mononitrate. She has developed tense blistering lesions on her legs. Each lesion is around 1 to 3 centimeters in diameter, and she reports that they are slightly pruritic. Examination of her mouth and vulva is unremarkable. What is the most likely diagnosis? A. Pemphigus. B. Drug reaction to aspirin. C. Epidermolysis bullosa. D. Scabies, and E. Bullous Pemphigoid. You will have an 84-year-old woman. The patient is old age. The old woman with a history of ischemic heart disease, which is using aspirin, simvastatin, bisoprolol, ramipril, and isosorbate mononitrate. She is coming with chief complaint of blistering lesions on her legs. And on examination, we can see around 1 to 3 centimeter in diameter lesions on their patients' legs. And on examination of their mouth and vulva, we cannot see any important findings. This question is showing that the diagnosis is not Pemphigus vulgaris, because one of the first presentations of the Pemphigus vulgaris, even before appearing the bulla and blisters on the patient's body, the patient has mucous or mouth involvement or vulva involvement. And the patient has blisters and bulla on her legs, and the diagnosis can, if the patient has no mucosal involvement, then the diagnosis can be Bullous Pemphigoid. Okay, the answer is Bullous Pemphigoid. Here we are going to explain it. If the patient is coming with blisters and bulla, but the patient has no mucosal involvement, at least in exam, the diagnosis can be Bullous Pemphigoid, because 10 to 50% of patients has some degree of involvement of the mucous membrane, but it's not common, which is asked in exam questions. But if the patient has mucosal involvement, the diagnosis is Pemphigus vulgaris. As we said, one of the first presentations of Pemphigus vulgaris is mucosal involvement. Bullous Pemphigoid. Bullous Pemphigoid is an autoimmune condition causing subepidermal blistering of the skin. This is secondary to the development of antibodies against hemidesmosomal protein BP180 and BP230. Bullous Pemphigoid is more common in elderly patients. As we can see here, our patient is an 84-year-old woman, and it's usually common in elderly patients. Features of Bullous Pemphigoid include itchy, tense blisters, typically around flexures, as our patient said that she had the blisters and bullas have a slight itchy. The blisters usually heal without scarring. Because they are superficial, the blisters are superficial, and they usually heal without. The blisters are usually subepidermal, and they heal usually without scarring. Mouth is usually spared, as we said. Usually we cannot see the severe involvement of the mucous membrane and Bullous Pemphigoid. In reality, around 10 to 50% of patients have a degree of mucosal involvement. It would, however, be unusual for an exam question to mention mucosal involvement, as it is seen as a classic differentiating feature between Pemphigoid and Pemphigus vulgaris. Here we can see Another differentiation is we can see clear bulla or blisters on the patient's body, but in bullous pemphigoid, but in pemphigus vulgaris, the blisters or bullas are so superficial, and we cannot see any clear blister or bulla on the patient's body, and instead we can see lesions on the patient's body. Skin biopsy. In skin biopsy, we can see immunofluorescence shows IgG and C3 at the dermoepidermal junction. Here we can see a subepidermal bulla in patient with bullous pemphigoid in histology, and here we can see the immunofluorescence of the patient with bullous pemphigoid, and we can see IgG and C3 deposition at dermoepidermal junction. Management of bullous pemphigoid, referral to a dermatologist for biopsy for confirmation of diagnosis is important. Oral corticosteroids are the mainstay of treatment in bullous pemphigoid. Oral corticosteroids are the mainstay of treatment, and topical corticosteroids, immunosuppressants, and antibiotics are also used. Okay, this was a short explanation about bullous pemphigoid and presentations. We talked about bullous pemphigoid and pemphigus vulgaris, the presentations and the differences, the differential diagnosis of bullous pemphigoid and pemphigus vulgaris in our YouTube videos. For more information, you can watch them. Thank you for your attention.